Thank you. Moreover, is my point.
Well, I have to say, I'm a doctor. I founded GenderGP in 2015, and I'm sitting here with my teenage kids. And one of them said to me, "Have you seen, Mum? Have you seen what's going on Twitch at the moment?" And I'm like, "Well, I don't even know really what that is." And so we've logged on, and I'm just like, I'm absolutely blown away that there are people out there that would want to support the work that we do to help people, because we've had a really tough couple of months in the transgender healthcare arena, and I'm literally blown away that there are people doing this modern kind of stuff that you're doing there, and I'm just so excited. Thank you so much.
Again, thank you for being here, and thank you for everything you do. And yeah, well, I mean, it's our honor and privilege to help. I have a lot of friends who are with GenderGP and for whom your service means the world. And to just think about Tavistock having to call up kids who are on blockers right now and tell them they're gonna be taken off their medication. It's awful. So I just wanted to do anything we possibly could, really, to change that situation and help. And then I found out that you had set up your fund to just directly sponsor patients, and I was just like, okay, that's it. Well, we're gonna do something then.
Yeah, I mean, I think that the GenderGP newsletter went out today, and it said, right, okay, we don't know anything about this, but we're going to set up this fund, and we're going to help as many people as we can, because I know GenderGP is a privately funded healthcare system, because we're not NHS, we're not publicly funded.
Helen, you seem to have cut out there. I don't know if something's happened. Hi, Molly.
Thank you.
Helen
Hi.
is just having some technical difficulties at the moment, but hopefully they'll be resolved in a minute.
Weird.
Okay.
Oh, hello, Helen?
Hi. I'm sorry, you lost me.
Yeah, we can hear you now, though.
Okay. Apparently, my kids tell me that my screensaver came on or whatever.
Oh, no.
Out, and then I lost you. I'm so sorry.
It's okay. It's completely fine. Happens to the best of us.
I was saying that that GenderGP, we've been working since 2015 helping trans people get the care that they need, and we're not publicly funded. We're not the NHS. We're not a publicly funded health service, and yet we get so many people who need the services because they're just not there. I mean, if you're a kid just about to start puberty or going through puberty, who would want to wait 3-4 years on a waiting list? It's just tragic what happens in that time. And I think the recent Tavistock ruling, for whatever reason that happened, which was an absolute tragedy, is going to cause so much harm in the UK. So I know that GenderGP, which I'm an organisation I'm incredibly proud of, just wants to help as many people as possible, because there is this feeling that trans people they need assessments, or they need are you sure,
as if it isn't hard enough already. There's my ex partner, actually, when he was being referred, the nurse he saw told him, this isn't going to be easy, and it was just like, yeah, actually, we do actually know that.
Yeah, I know that. Yeah, it's not easy. We didn't choose this. This isn't easy. Absolutely, really hard.
Yeah.
I remember. Sorry.
I was just going to say, and then the people who arrange campaigns to try and take away funding and our access to healthcare, they rely on this myth that it is easy and that kids are being pushed onto stuff or whatever, and it's just like, no, it's actually really, really hard as it is. It doesn't need to be made any harder.
No, absolutely. And we went to America, actually, and we listened to Joanna Alston Kennedy, who was talking about, she taught me so much, and she was saying, look, these young people, before they come out, they have spent so much time coming in. They have spent years and years and years working out what this means to them.
Right.
And then one day they go, you know what? I am actually going to come out today. And then someone says, are you sure? And it's like, Jesus, do you know how long I spent coming in and working with them?
Right.
And then they're like, are you sure? No, it was so interesting.
I saw someone say, and I thought this was wonderfully put, like, to parents who are so concerned about the idea of their kid being trans or being tricked into being, a trend or all this nonsense. Yeah. A trans person is going to come out. The difference a parent makes is whether they are accepted and loved and have a good relationship with their parent in a supportive environment when they come out at first, or whether they repress it for years and years and just come out later. It's just about the question of whether it's years and years of holding on and suppressing things, or having a good supportive environment right then.
I think that's so important, and that counts for whether you're coming out to a parent or their first trip to the doctor. It's really important.
Absolutely.
You've been building up to it for years, and then you go to the doctor and you go, right, I've got something to tell you, and then they're like, what?
Exactly.
I haven't heard that. Exactly. Oh my goodness, are you sure? Are you mad? And it's like, no, this is me. Understand me. This is. Yeah. So important.
And I think it's significant that the lawyer who was fighting for this ruling that's happened, is also worked on cases where he's trying to push the idea of I don't know if it's fetal heartbeat, but it's certainly like the same kind of like precautionary warnings against abortion and stuff, because it's the same logic. It's just like trying to make it as hard as possible and try to make it so doctors have to give a million more hurdles to people before they access necessary healthcare that in many cases is life-saving.
Well, I totally agree, and I think the sad thing is that healthcare is needed at all, but it is, and this isn't a medical condition. This isn't a disease. It's not a disorder. It's not a.
Thank you.
It's not a problem. It's just part of us. But we, a little bit like contraception, we would like something just to help us along the way.
Exactly.
And that's that. So when you don't need a massive assessment to get contraception. You don't need a massive assessment to do this or the other.
Exactly.
But if you're trans, you need a massive assessment. Exactly. But actually, GenderGP, we don't. Absolutely don't.
Right.
We believe that the person knows absolutely about their identity. They are the expert in themselves. And then the doctors can help them just with the medical bit. Is it safe? Are you doing the right thing? Is the dose the right thing? Is that drug the right one for you?
Right.
But
absolutely.
Nothing to do whether you're trans or not. That's completely an innate personal. Really important.
The fact that you're seeking out healthcare is a pretty good indicator that you probably, the fact that you're seeking out trans healthcare is a pretty good indicator that you're probably trans.
Well, why would you? Why ever would you if you weren't? Like,
Right. I mean, my first appointment. Sad to say, Helen, I'm very sorry. I'm with GenderCare, not GenderGP. But my first appointment was 300 quid. I'm not doing that because I'm like unsure of something. I'm doing that because I'm very sure.
Yeah.
We've actually got one of our guests, Molly, wanted to come on and talk to you because she is with GenderGP, and I believe she wanted to say thanks.
Yeah.
Molly, are you okay?
Oh, Christ.
Oh, shit. Hello,
Hello.
Dr. Webberley, Helen.
Hi.
Hi. So, words. I know how to do these. So, about 3 years ago, actually just under 3 years ago, I sent an email, terrified, to GenderGP. I'm like, hi, I live in Ireland, brackets, like the Republic of or something. Yeah. Can I go on GenderGP? Because I came into my GP here and it was like, oh yeah, well, you go on a waiting list. And I spoke to some Irish trans people and it was like, oh, the minimum waiting period is 3 years or 4 years, depending. And right now, they're just not seeing people and they're not giving you an idea of how long you're going to be seen. So the joke is most people are going to be very far along in their transition before they actually get seen in the Irish healthcare system.
Yeah.
And I ended up, it was like this, I get this phone call from GenderGP and I'm speaking to one of your psychologists and I start talking about gender performativity and all this hypothetical philosophical stuff. Yeah. And the psychologist just said, sorry, can you just say you're a woman? I was like, well, yeah. And she's like, okay, that's fine. I've spent 40 minutes trying to justify and buttress and explain everything. And she's just like, can you just confirm you're trans? That's fine. and I got HRT. Like obviously there was the intermittent problems with Brexit, but I've still managed to get HRT from GenderGP, and without without the service, I probably wouldn't be here. And
Yeah.
I know you've had such stupid hurdles and legal challenges, and you've dealt with them in the most dignified manner possible, probably much more politely than I would ever be able to manage. And I can honestly say you've saved a lot of lives. Okay.
Well, Molly, honestly, when I often say when you're a young teenager and someone at school says to you, what do you want to do? And you say, oh, I want to be a doctor. And then they say to you, oh, why is that? And you say, oh, because I want to save lives. There are not very many doctors actually that get to save lives. And I hope that that's true. But I have to honestly say, in my career, I'm 51 now, I'm 51 years old. But in the last 6 years, I've been working with transgender patients. I must have saved more lives than I can ever count. And it just should not be this way, because the lives that I and GenderGP have saved are young people, teenage people, 20s, 30s, 40s, 50s, 60s, 70s. And these people just should not be dying. And the trouble is they're not counted, Molly, are they? These people whose lives that we saved are not counted anywhere. And that's the absolute travesty.
I had spent nearly 20 years trying to repress and ignore and postpone, and I came to my wit's end, and I was like, okay, we're either doing this or we're not doing anything anymore. And it was literally a light at the end of the tunnel, and I just wanted to come on and say thank you so much.
Oh, well, I tell you what, I'm hugging my iPad now to hug you, because I can hear your voice, and I want to transmit everything that I can transmit to you in terms of love, hugs, and support, because actually you're the brave one, standing up and saying, I can do this, I can come forward, I need this, and I'm going to get this. And I'm so pleased that we were able to help.
Thank you.
Thank you, Molly. Happy Christmas.
Christmas to you too. Oh my God, sorry. Wow, made that very heavy. Everyone, we're going to play a video game.
Yeah.
Yeah.
I'm pretty sure every hearing trans person right now is probably a little bit tearing up, or a lot tearing up.
Helen, you left a message with your donation. Could I just
Sure.
clarify what you made a pledge
Yes.
off the back of this?
Yeah. So listen, I said at the beginning when I came on that when the Tavistock thing came through in the beginning of December, we at GenderGP were like, oh my God, what are we going to do here? How are we going to help? And of course, there are private healthcare has the label of being really expensive. We've always tried to be as affordable as possible. Yeah. But of course, we're not NHS. It's not free. It has to be paid for.
Right.
But what we want to do, I mean, when someone showed me this stream tonight, I was just like blown away that any group of people, gamers, would want to come through. I called all my kids, and I've got 3 teenagers. I've got 2 boys and a girl, and 2 older 20s. And I'm like, guys, what is this? What is this Twitch thing? What is going on? I need to see what's happening, and they help me. But we at GenderGP just want to help, and unfortunately the blood tests cost money, and the medication costs money.
Yeah.
And actually the people that work for GenderGP, the pathway team that serve the patients every single day, they cost money. So we can't do it free, but you guys have raised so much money, and what I would like to say that GenderGP will match you whatever you raise here today or over the next few days in supporting trans people to get the healthcare they need. GenderGP will match that exactly in time, effort, whatever the fees might have been, and to match exactly what you raise. And it's difficult for me because I'm just a doctor and a mother and a passionate advocate for trans people. So I don't know how this kind of thing works, but I promise you that GenderGP will match whatever you raise to help as many trans people as we possibly can. And I know I've seen the messages coming through today about young people absolutely desperate not to have to face puberty. Older people, not older, but older than puberty people, kind of teens to young 20s, saying, but what about me? What about me? I need your help. And then there's older people as well, there's 50s, 60s, 70s saying, but can you help me as well? I can't afford it. And honest to God, we would want to help every single person we possibly can in the most affordable way. Right. So I don't know how else to say it, because I'm not I don't have those skills of charitable funds, but we will match anything that you do.
Thank you so much. Thank you so much.
Helen, I'm very sorry. You listed a doctor and mother. You left off saint.
She's right. She's right.
Well, I don't know about that, but I know. I sometimes, when people often say to me, why transgender people? What's the thing? And they often say to me, look, Helen, you've been through a lot yourself. Why don't you just ditch out? And I'm like, you haven't met this community. If you don't understand this, you haven't met the children, the young people, the adolescents, the teenagers, 20s, the 30s, the 40s that are living this every day. Right. Come and meet these people, and then you will completely understand in the same way.
Thank you. Completely. I couldn't have put it better. That is exactly it. Thank you. Just thank you for that, and thank you for everything you do. Thank you for saying that. That's wonderful. It's really meaningful to me that that you're saying to match sponsoring patients, because it's I mean, advocacy and trying to turn back the ruling or raise awareness, and all of these things are so important. But I just, the thing that's keeping me up at nights is thinking about the kids who are being taken off medication right now, and the kids who can't access medication right now, and that's what truly matters the most to me, is thinking about people who can't afford, or can't afford in time because they can't afford to wait, or they can't afford in money. That's the thing that matters to me, is treating patients, and so I'm so happy to hear you say that.
I think that's a really good point that I've not considered before. Actually, it's not just about affording money, but it's about affording time.
Exactly.
And puberty marches on. Right. And actually, we had yesterday afternoon we had our Christmas virtual Zoom meeting. So we all got together on Zoom, and we had raised a glass of wine and talked about the future and talked about what we'd achieved. And our mission, one of our missions, you set the missions for 2021. And our mission was that not one young person would have to go through a puberty that they didn't want to go through. And can you just imagine if that was the future, that no person went through that puberty? And okay, so some of them are going to say, oh well, they might change their mind. Okay, that's fine. They might change their mind, but let's just let them press pause for a minute, and then let them change their mind in 1, 2, 3 years if they want to. But don't not let them press pause just in case they might change their mind. Press pause first, and then let's see what happens in the future. And that was our mission for 2021, which I feel a little bit exclusionary from the older people, but of course they count so much as well.
Yeah, of course. Thank you so much. I don't know what to say besides thank you. I'm just so elated by all this.
Well, listen, I tell you what we can do. So I'm really, okay, I'm going to say those boomer words like Discord, Twitch. These are all very new things to us. That obviously is a big part of the young community. And what we need to do is reach out to younger people through software such as this, and help. I came on here as a boomer. You've helped me come on, and I think if this is the medium to help people in the future, then we should do this. And I'm going to go right back to the beginning where I say thank you so much for setting this up. I was honestly so excited when I saw it, just because this is going to help so many people have a good Christmas, and I'm really, really grateful to you.
I have been overwhelmed. I was hoping we might raise £10,000 by the end of the 3 days, and within about 3 hours we hit the goal. So it's going pretty fucking well right now. It's wonderful.
Yeah, I'm so grateful. And listen, if you want me to come on tomorrow, and when there's other people on, I could talk for England, Wales, UK, the whole of the world on this matter. So if you want me to come on tomorrow,
Okay.
however you can get hold of me, Twitter.
That sounds great. Yeah.
Yeah.
Let's arrange that actually.
Okay.
A proper arranged slot, and we'll have a chat about stuff tomorrow.
Okay.
Fantastic. Thank you so much, Helen.
Okay, really nice to join you. Good night to everybody, and thank you so much for everyone who's helping.
God bless you, Helen. Thank you so much.
Good night.
Thank
Bye-bye.
you. Bye-bye.
Whew.
Wow.
Wow.
Well,
That was incredible.